Alright, today we're going to be going over the QuickTrach airway device. Basically what we have here is a training mannequin. It's supposed to simulate a throat. The QuickTrach kit, which is in here, it's basically a needle attached to a catheter and then a tube where you can bag the patient using the bag valve mask, which is right here. So this would be used in, usually, most often it's used in trauma scenarios where the patient has facial injuries and you're unable to get a regular airway in through their mouth. This is kind of a last resort where you'd want to capture their airway using a QuickTrach. So basically what you do is you're looking for the Adam's apple, which is the thyroid membrane and the cricoid membrane. There's a little soft membrane in between, so if you go just above your Adam's apple, you can feel it right there, actually just below it. So you feel for that on the person's throat, then you can feel a little soft hole in there. So that's your landmark that you're shooting for with this needle. So what you want to do is cleanse the area with an alcohol wipe to make sure everything's sterile. You want to insert the needle at 90 degrees once you find your landmark, which is going to be kind of hard to push in, obviously, because you're going through a pretty tough membrane there. Once you get it in, you want to switch the needle to 60 degrees and advance. Once you're in there, you want to pull back on the syringe. If you pull back and you're getting blood, tissue, any kind of fluid, you probably aren't in deep enough, or you're in too deep and you're getting something else. So this should be clear coming through there, and it should be able to push back in. So once you do that, you pull the catheter, the needle out of the catheter. You want to put that in the sharps container, which we don't have. But then you want to take your device that connects to your BVM, connect it there. Make sure you hold on to this too. You don't want this moving back or forward. You could pull it out of where you're trying to shoot for. Once you connect your bag valve mask, this is usually done with two people, you want to squeeze on the bag and you can ventilate the patient this way. You can see the air going in down there. So once you get this in, you definitely want to get your stethoscope out, check your lung sounds, make sure you're getting air movement into the lungs, like I said. But if you get air in your catheter or in your syringe, then you should be good to go. If you're getting blood and stuff like that, you're probably not in the right spot. That's pretty much it.